application starts by logging in. As I log in, I see the calendar. Right now, looking at the provider review. So these are all the providers. There's an option to go either facility view or the provider view. This is the facility view. These are all the time slots where you can actually make an appointment. Now I go back to the provider view. I can select any future time slot. If I try to select any previous time slots in the past time, it will like this is the future time slot. If I go back to 18, which is yesterday, it will tell me the no appointments available at this time. I can select any time slot. I select the time slots. I have option to select a facility. These are different clinics that are currently set up in the system. I select a clinic. I define the time. I select the provider. These are all the in-house providers in the system. The starting time slot. Currently there are 15-minute time slots defined from 9 a.m. to 9 p.m. Resource is the referral doctor. Setting the referral could be self, could be anything. Visit types, they are also defined in the system to define the kind of visit the patient is making for billing purposes. Visit status, when it's created, you can define either it's cancelled, pending, checked in. Reasons, which is not required, but this can also be defined in the system. Patient. Now there is a real-time search. You can select, you can start typing, and it should give you the results as you type. So here I type certain names and I get the results. Either I can select these names, or I can add a new patient by clicking on this button, the add button. This is to upload any documents to that particular patient or to that particular appointment. This is to see the detail of that particular patient that I've selected. This is the patient. I can see their previous referrals, the history, visits, their appointments. Or I can click this and add a patient. I can add a patient, self, this for insurance purposes also, self or other. I have option to add multiple insurances for any patients. Cancel that. Note templates. These are predefined texts for notes that are also defined in the system. Like pain says this. This is just a test. So you can all define this. So if there's a whole bunch of pretext, the front desk person or the person who's making an appointment can make certain notes, can add certain notes for the doctor. Once the appointment is defined, you can see it will show up here. There's also option to print the appointments. This is the print screen. It looks like with all the doctors and their appointments showing on one screen. You can also view the calendar of each doctor by clicking on the doctor, and it will show you the full calendar of their appointments. Then there are options for patients. These are all the patients in the system. You can add a patient, or you can see an existing patient. When you click on an existing patient, it shows you Patient Hub, where you can make an appointment directly from here. A new telephone encounters, a new alerts. Their document center, where you can upload their x-rays or any other related documents. Alerts for doctors to if they need some sort of an access, handicap access, or additional payment needs to be made, their recent activities, recent appointments, and any additional notes related to that patient. Specialty providers. These are the providers. These are not the primary care specialists. They are the specialists. and the group is defined as if they're working in-house or they're remote. So when you create and add specialty provider, you define a group either in-house or remote. As you can see, the difference between in-house and remote is the business name. Every outside provider would have some sort of a business name. It could be their name, or PC, username and password, so they can log in and see their patients, or upload or download or send any referrals. Other informations are there for billing purposes. Providers. These are the primary care physicians in-house or remote. So when we click on any physician, we have an option to define their name and add multiple insurances that they accept and upload their signatures. So any notes that are saved in the system would have their signature. Specialties, you can define the specialties. Users, these are the users of this particular system. You can define roles and assign roles to these users. Roles are, you can create a role for a number of privileges. The entire system, like you can restrict the user just for appointments, managing appointments or managing visits. These are some of the standard reports built in the system. Visits and billings are the two sections that the system provides basic billing support for HCFA forms. As you can see, you can check out patients. When you check out patients, you have an option given with the template where a biller or a doctor can select the certain CPT codes. These CPT codes are also defined in the system. As I would create a visit now, and I'll say create visit. Once it creates a visit, you will see their batch files. The batch files are the files that are actually sent to a WebMD. The application is approved by WebMD. You can look at the a standard HCFA file. This is a standard format for HCFA that is accepted by WebMD, approved by WebMD. Miscellaneous is where you define custom settings of the system. Unit type, facilities, insurances, CPT codes, diagnostic codes, notes templates. All the options in the system that are given in the pull-down menu can be defined here in miscellaneous.